Hi, Dr. Daly. This is my video reflection assignment. So this is 3 slides. So the first slide here says what surprised you from the materials from this week and what did not surprise you. So what surprised me was I was not expecting to learn about mental disorder or substance abuse in this course, since we are learning about pathophysiology. But I was not totally surprised because mental disorder is a part of, mental health is a part of overall health, and pathophysiology is the study of the physiological process of the body that leads to disease or disorders, and also the disturbances in the normal cellular function. So mental disorders or substance abuse definitely affects the body. So it only makes sense to learn about to include that in the process of learning about pathophysiology. So that's that. And then the second slide, identify 3 things you learn about mental disorder. Well, these are things that I already knew because I am a psychiatric nurse, which I've been for the past, for the majority of my career. So I know that mental disorders encompasses a broad range of conditions. As we all know, anxiety, mood disorder, or psychotic disorder, and these are like depression, schizophrenia, or panic disorder, or generalized anxiety disorders. And then also the stigma and awareness. So there's a lot of stigma associated with mental disorders. So people who have mental disorders usually are afraid to seek help, or they do not seek help because of the stigma of being labeled as crazy, dysfunctional, or weirdo. But the truth is that some individuals that have mental disorders are either born with it because of the genetic predisposition. They either born with the disorder, or they acquire the mental disorders through from trauma, which is a childhood trauma, or in adulthood. I have taken care of many adult patients who have psychiatric issues that they acquire from trauma that they experienced as a child, being abused by strangers and family members, and they never recover from that. So that's that. So people need to just be aware of the stigma and just know that some people that have mental issues, it was not by choice that they have these problems, and just be mindful and do the best they can to help them. Treatment. Some mental disorders are treatable with medications, or the symptoms can be managed with the proper medications. Like schizophrenia, for example. People who have schizophrenia, they hear voices, they have delusional thinking and things like that. But there are medications for the antipsychotic medications that helps to drown the voices. And so with the proper treatment and medication and care, people with mental disorder are able to function well, and hold like jobs and stuff, and contribute to the society. So that's that. And then the last slide, it says identify 3 things you learn about substance abuse. Substance abuse can be very addictive. Substance abuse involves harmful and hazardous use of psychoactive drugs that are very addictive. we just learned this, but I knew this before. Once the brain and the body cells become adapted to the drugs, the individual will have to keep taking it in order to function, or else they will have to go through withdrawal. Symptoms which could lead to seizure, and like sometimes death. So secondly, it's very dangerous impacts on the health. So substance abuse have severe negative impact on physical and mental health, including drug overdose and death. That's like the most common thing that can happen with drug abusers is the overdose and death, because like I was saying earlier, when your body gets build tolerance, that's the word, tolerance for the drugs, you have to take more and more in order to get the same feeling that you got before when you first took the drugs. So because of that, it's easy to overdose on it because you will take a lot more than your body is able to handle. So overdose and death is one of the the severe impacts of drug use. Stigma, also comes with substance abuse, because people who abuse substance are also afraid to seek help because due to the judgment and fear of being labeled as drug addicts. Majority of people who do substances, they use drugs to mask our physical and mental pain. I know a lot of people that I have taken care of started using drugs because of childhood trauma like molestation or physical abuse, just things that they never got over. So, or even the body aches like from like injury, painkillers. So most of the people that I've taken care of usually got hooked on drugs, because of trauma and depression, from childhood trauma and things that they've been through, or life changes. And some people began to take opioids after they got severely injured from work, or and then they became addicted to the substance. So it's always good to assess the individual and find out why they started using drugs in the first place, or why they're having mental disorder, and try to help them as opposed to being judgmental and just push them aside, without helping, because people are suffering from mental health disorders, and they really need help. And some of these people, it's not their fault that they're in this situation. It's things that happen to them. And I was one of the people that didn't really took the time to look into why people do drugs and why people have mental illness. But as I began to learn more about it, that's the reason why I got interested into doing psychiatric nursing, and now I'm trying to go for my psych NP, because I really learned that people don't just wake up in the morning and start doing drugs. There has to be something that made them to start doing drugs in the first place. Or people who are psychotic, yes, some people are born with the psychiatric issues, but some people really became like that not by choice, but because of things that people have done to them and things that they have been through. So these people are very vulnerable in the society, and they need a lot of help and care. And that's one of the reasons why I got interested in psychiatric nursing, and I'm going to become a psychiatric mental health nurse practitioner, which I'm looking forward to. And what I've learned from this course that I can apply to my career is the whole pathophysiology portion of it. Before I took this class, I didn't realize how much I have forgotten all about pathophysiology. I mean, literally everything, because I've been a psychiatric nurse for about 10 years. And usually when I have a patient that has a medical issues, I do referrals to the medicine doctor, and then that's it. I don't worry about it anymore. They're in the hands of the medical doctor, and then that's that. But it was good that I learned this course. It was really good to take this class, because I realized as an advanced practice RN, your patients will expect you to know everything because you are in that position. So if I were to have a patient that will come in with some kind of medical issues, GI bleed, or they tell me that they're, having some kind of symptoms like reflux or something, I should be able to help them, or I should be able to explain to them what's happening to them before I do a referral. So that way they will have an idea of what's going on with their body, as opposed to just referring them to the doctor without any explanation. So I think taking this course for me was an eye-opener that, I need to know about pathophysiology, or as a whole. Even if I'm going to be a psychiatric mental health nurse practitioner, but I have to know about the pathophysiology portion of it, because I should be able to explain to my patient if they're having medical issues. I should know what's happening with their body and how to explain to them what's happening, so that they can be aware of the situation, as opposed to just brushing them off and referring them to the doctor without explanation. So it was a great class. It was intense. I'm not sure how it's gonna end, but it was good to learn this class, because I really believe that there's a lot that I need to know about the human body, and not just the mental health portion of everything. So I'm going to keep all my notes. The guided notes were very helpful. So I'm going to keep all my notes and refer to them as I work in my field. At least it will be a help to me, and I will also try to do some reading on medicine, to be able to refresh my knowledge, and to be able to understand the whole pathophysiology portion of the body. And I think it will be very good for my career. And thank you so much for everything, and it was great to take this class. Thank you.